Hi everyone, my name is Magdi Maher, and today I decided to start a series of videos for the purpose of health teaching and health education. And today the first topic I will discuss is about Bell's palsy. Bell's palsy is an acute facial paralysis which usually affects one side of the face. It is sudden, rapid onset, and fast progression. The symptoms usually develop overnight. The facial nerve, the seventh cranial nerve, is affected, which causes drooling of the same side of the face, drooping of the same side of the face. Bell's palsy was named after Charles Bell, a 19th century Scottish surgeon who first described it. The facial nerve, the seventh cranial nerve. It travels in a bony canal in the skull beneath the ear, and it reaches the muscles of the face on each side. And it's responsible for smiling, for blinking, for frowning, also for saliva gland and tear gland control and the sense of taste. And once an infection is caused, the nerve is compressed and may cause damage or cause Bell's palsy. Bell's palsy is an acute disease which is responsible for 80% cases of facial paralysis. It equally affects men and women. It's common from adulthood to old age. It's not a contagious disease. Also, those who suffer diabetes or prone to flus or cold are more susceptible to get it. The symptoms of Bell's palsy are all of a sudden. The disease reaches its peak from 48 to 72 hours. In some cases, the symptoms subside within 3 weeks. Actually, in most cases, but some cases maybe take from 8 to 10 months for the symptoms to subside. And in few cases, there is more complications and persistent weakness of the muscle. For the symptoms of the Bell's palsy, first we have the face paralysis. There is muscle weakness on the affected side of the face. There is drooping of the face and the mouth on the affected side. There is numbness on the affected side and twitching. There is saliva drooling. There is also difficulty in closing the eye and the mouth. For the eye symptoms, there is an increase or decrease in tear formation. It's difficult to close the eyes, therefore they become dry. And if you do not protect your eye, ulceration and injury may happen. For the mouth, It's difficult to chew, to eat, and drink. There is drooling of saliva, and there is a weakness. For the ear, there is pain around the ear, and there is intolerance to loud sounds. Let's move to what causes Bell's palsy. First, inflammation of the nerve. When the nerve is inflamed, it swells and it becomes compressed inside the bony canal, which leads to Bell's palsy or cause Bell's palsy. Secondly, viruses. Viruses are the most common of Bell's palsy, and such as herpes simplex virus or cytomegalovirus. Also, injury to the nerve. Even though the nerve is really safe inside the bony canal, but any trauma or accidents may cause damage to the nerve and leads to Bell's palsy. Now let's move to the do's and don'ts. Since you cannot close your eye, or it will be difficult to close your eye, you will need to use artificial tears to keep your eyes moist. Secondly, since you are in pain, you'll be in pain, it's better if you get a cotton towel, put it on warm water, squeeze it well, then put it on the painful side. It will make your pain less. Also, you need to exercise your mouth muscles. So they become stronger. Also, you need to eat healthy food. And for the don'ts, do not eat big bites of foods or hard foods. Usually, in some cases, the doctors give liquid foods in complicated cases. When it comes to food, you need to eat healthy food such as vegetables and fruit. You need to avoid drinking coffee, alcohols, and smoking. You need to consume less arginine-rich food such as sesame seeds, hazelnut, Brazil nuts, and pumpkin seeds, because viruses require arginine for multiplication. Also, you need to avoid foods that has artificial coloring and preservatives. Thank you for listening to the video. If you have any questions, you may comment below. And if you have any diseases you would like me to discuss next time, please write it down, and I promise I will discuss it in the next videos. Notice again that this video is for health, teaching, and education. Thank you so much for listening.